A very good morning to one and all. At the outset, I would like to thank the organizing committee of the 7th International Conference on Forensic Research and Toxicology. Thank you so much. It's not the first time I'm here as a keynote speaker. I have some very good and pleasurable memories with Team Conference Mind. Thank you so much. Namaste to one and all. I had certain professional commitments on 12th and 13th, and I really apologize for the same that I couldn't be live. So I'm sending, my recorded presentation to my team, my family, Conference Mind. I'm Dr. Arpit Sikri. I'm currently working as associate professor and postgraduate teacher in the Department of Prosthodontics, Crown and Bridge, and Oral Implantology in Bhojia Dental College and Hospital, that is in Badi, Solan, Himachal Pradesh, India. So I'm here to represent my own country. I'm humbled, privileged, proud to represent my country on this great international podium. Thanks to God for this, thanks to the Almighty. And I'm going to speak on the topic dental detectives, the applications of forensic prosthodontics. Well, to introduce the basic thing which comes to anybody's mind when we talk about forensic prosthodontics is what is forensic odontology. So just in brief, I'll be telling about what is forensic. So forensic is nothing but basically it's a Latin word which has been derived from forum, which means the court of law. It is just a branch of forensic medicine dealing with teeth and marks left by the teeth, particularly in identifying the criminal suspects or the remains of a dead person. Odontology, as the name suggests, is the study of teeth. So it is defined as that branch of dentistry in which the interest of justice deals with the proper handling and examination of dental evidence and with the proper evaluation and presentation of the dental findings. So prosthodontics has a pivotal role to play when we talk about forensic dentistry. So it's a whole team, and as we say, team means together everyone achieves more. So prosthodontics definitely plays a greater role, has a greater impact when we talk about when we study forensic dentistry, and particularly prosthodontics helps to identify and maintain the dental records, which is really, becoming day by day important as we talk about. So what is the scope of forensic odontology? It helps to identify unknown human remains through records, dental records and craniofacial bones, recognition and analysis of bite marks, which is found on the victims, analysis of orofacial trauma, which is associated with persons abuse, and helps in determination of gender of unidentified individual. Not only that, if you talk about the evolution of forensic odontology, it helps to elaborate records the same way it helped, the crowns and bridge, they come under prosthodontics. So it was the one which helped to identify the body of Adolf Hitler that time, the most high profile case of dental identification. Not only that, secondarily to that is the Saddam Hussein capture, which was identified using a DNA sample from the oral cavity using saliva. So role of forensic odontologists and that to the prosthodontist helps in dealing the various autopsy cases, which is really, becoming indispensable day by day. So prosthodontist, as I told you, has a bigger role to play when we talk about forensic odontology. Rugoscopy, chyloscopy, lip patterns, engraving records into processes, impression making, bite marks. I'll be taking all these subsequently in my slides. So the most important thing, whenever we talk about the forensic odontology on what is the role or impact of the prosthodontist when we talk about the forensic odontology is by engraving the processes. Now, there are two things. Either we do it by surface method or we do it by inclusion method. There are a couple of inclusion methods like the ID band, laser etching, T-bar, electronic microchips, lenticular system, RFID, frequency tags, photographs, barcodes, and a couple of other, the chyloscopy, rugoscopy, bite mark analysis, sex determination, and DNA forensic odontology. And definitely, I'll be talking about how do we, go in for sex determination. This would be taken up in the subsequent slides. So, a very important, when we started off including prosthodontics in forensic odontology, the most common thing was to engrave any record in the processes. The most common we talk about is the denture marking system. Everybody must be knowing what is a removable complete denture processes. So complete denture, definitely when the patients, they tend to get aged with a period of time, geriatric individuals who don't have any teeth, completely edentulous patients, particularly in those cases, we give complete dentures to the patient as a duty as a part of the prosthodontic curriculum. We do deliver these dentures to the patient. So, as a part of labeled dentures or the marked dentures, they are very important to identify the owners in case of any accident, loss of memory, state of unconsciousness, or in case the patient is not, identified, he or she is misplaced anywhere like that. Sorry, this reminds me of, we have done a similar case report a couple of years back, which was also published in a reputed international journal. We have engraved, we have included Aadhaar card. Aadhaar card is very peculiar as far as the Indian subcontinent is concerned. And, that gives a true identity to any individual. So what we have done is we have taken that Aadhaar card number and a code, barcode, and we have incorporated that in the complete denture, which was already given to the patient. And this was one of the studies which was published around about in the year 2018. So very common method, surface method. They were very commonly practiced in the earlier times when the application of forensic or prosthodontics was just started in forensics. So it was like including writing, scribing on tissue surface, on polished surface with fiber tipped pen, emboss initials of the patient in mastercards with burrs, and engrave. The reason was, whenever we engrave something, complete denture has a polished, well, smooth, and polished surface. What happens when we engrave surface on that particular engraved surface? There are high chances of food entrapment and debris. So food debris most likely tends to get accumulated on that particular engraved or a rougher surface area, and that helps to accumulate more food and accumulation of the plaque on that particular area. So this was how, this is a very old picture showcasing how the surface methods were practiced. Many commonly use, this is a, straight acrylic trimming burr, which has been used to, include or emboss particular name or some kind of identity to the processes. A very common method later, because, surface methods were later discouraged. So that is how it gave advent to the inclusion methods. So they include a couple of methods which are included in this particular heading. That is the paper strips. So that is a very inexpensive way. You take a piece of onion skin paper, relatively, which is more durable than the regular paper which is available, rough paper. Normally, which we can use, or what we can do is we can just place a double layer of cellophane over the normal paper, and then we can incorporate in the processes. So this strip was easily available. It was used and placed between the ridge and center of the palate of the fitting surface of the denture and covered with acrylic resin before final closure of the flask, so that it becomes a part of the final denture processes. Now, generally, we make sure either in maxillary or mandibular denture, we always check for the thickest area of the denture. If we have the thickest area of the denture, whenever we are including something, we make sure that we utilize the thickest area of that particular removable complete denture processes, so that one thing, it doesn't furthermore increase the bulk of the processes, doesn't lead to, process or patient may be complaining about that particular denture is very heavy or heavy to use or bulky to use. So that is how we appropriately, just to justify the region in which we have to localize that particular inclusion, any kind of inclusion method which we have to use, we do it like this so that it maintains the integrity of the complete denture processes. So this is how, this is just a diagrammatic view what we do. This is a maxillary denture, and at three places where we see that these particular areas, they have the maximum bulk. in this particular denture, we try to include it so that it retains the integrity and shape of that particular processes without the patient complaining that it is, bulky, it is very heavy processes, without causing any further discomfort to the patient. ID band, particularly, when there are unfortunately fire incidences. So in that particular time, dentures, they may be, we mark those particular dentures or we label those dentures, paper will definitely burn at a very higher heat or a very higher fire related incidences. So at that point of time, this led to the advent of stainless steel bands, most commonly titanium, because it is said that titanium resists heat or fire at a very, very high temperature. So definitely anything which is related to titanium would be preferred, particularly when there are certain accidents or fire causing accidents or any fire related incidences. Unfortunately, in that point of time, we can use the metric stands or coding systems in which we can particularly, give some identity to the patient. We can give some code, anything you can give, which helps you to identify that particular patient in any kind of crisis. Laser etching, again, it helps to identify, there are certain cases which are partially edentulous. In those particular individuals, either we give a conventional flippers, acrylic based partial dentures, or we give a metal based partial dentures. Now, this is a metal based partial denture. And even in such cases, we can, incorporate the ID band or a titanium or something like this laser incorporated, identification to the particular individual. A T bar, again, it is just a form of a T. So it is fast processed in the complete denture, and it is just a printed label against the flat surface of the bar, which is fixed. So it is in a form of a T. So we make sure that it doesn't. The only thing what I feel it can actually increase the bulk of the processes. So the T bar has to be judiciously placed in the complete denture processes or removable partial denture processes in case we have a very long span. So probably it helps us to produce a clear window displaying the ID label. So that is again a diagrammatic view of T bar. The only thing is it can be very easily situated in the denture base. Make sure you utilize the bulk of the processes and never ever, increase the further bulk of the processes by incorporating the T bar in the process. So this is how T bar labeled denture looks like. And now this is utilizing a patient's name. Now there can be many patients with the same name. So that is how, in case if we are using a patient's name, we should give some sort of identity or peculiar identity, like the one I told you in the previous slide. Aadhaar card, already we have done it a couple of times. We have done it in our patients in the hospital setups. So it gives you a clear picture. Aadhaar card is already peculiar to a particular one person, a particular individual. They have a true identity, true authentication as far as the Indian subcontinent is concerned. So the same way, even if the patient goes somewhere around the world, anywhere the patient goes, that code, that number would give a true authentication to that particular individual. And the other person also comes to know. Suppose that there is some other forensic prosthodontics who is, practicing in the US or somewhere else. So he or she would probably come to know, seeing that particular Aadhaar card number, or they would be knowing that this is linked to the Indian government. So this particular missing individual is an Indian individual with this particular Aadhaar card number, or maybe not only Aadhaar card number, there can be some other identity which can be included. The names can be, what I feel, they can be misleading, because so many patients with same name, they come to us, so we would not be able to justify that this person is the same that person or electronic microchips. They are again pre-sized. The selective size, stock size, they are available 5 into 5.6. But the only thing is they are to be inscribed by the manufacturer, not the dental surgeon. So this is a limitation, because what we can customize, the kind of processes a prosthodontist can give, I think it's the best, rather than anybody else can understand. Because if the manufacturer inscribes it, this would definitely lead to a greater bulk of the prosthesis. This is how the electronic microchip looks like. This was, there was an era when the pen drive just started. So that was the time, we used to use this memory cards and pen drives. That was the time. So now, when, very small, mini-sized gadgets are available. And, science has done wonders with the period of time. We are in the, era of artificial intelligence, and this is how, these gadgets have relatively helped us. But the only problem with the earlier used gadgets was that the bulk, because they themselves are associated with a very larger amounts with they are very heavy, so incorporating them becomes a cumbersome process many of the times for the prosthodontist. Not only for the prosthodontist, it's very, a prosthodontist wants his or her patient should be the happiest patient, and they should feel that comfort, but giving such heavy gadgets would relatively increase the bulk of the processes, which would lead to further discomfort to the patient. Lenticular system, again, it was a system, an illusion of images, which was viewed from various angles. So any information which is given, which is incorporated in any microchip, lenticular cards, they cannot be changed. So it is all stored information. But the only thing was that a relatively very higher temperatures of fire or fire related incidences, the lenticular card would be damaged at a particular temperature. So that was the loophole of the lenticular system. Although they were again, relatively thin lenticular systems have been available, and they can be seen, they can be well incorporated in the complete denture processes. Radiofrequency identification tag, again, it's a cosmetic effective labeling method, helping in the reliable identification by the wearer size. So the only thing is that you can store a large amount of information, any sort of information, address, occupation, driving license number, other, any identification which helps us to find out the individual, that can be stored in the RFID tags. They are again, relatively thin, easily available, even available nowadays, and can be easily incorporated by the prosthodontist. Patient's photograph. Now, sometimes, there are a couple of patients, they come to us and they relatively, they say that, doc, please incorporate our photograph. I looked, in my 30s, I was like this. In my 40s, I was like this. So, patient purposely, they come to us as a prosthodontist, and, we have to, come over the expectations of the patient. And there are, certain patients, and we have, in which we have actually practiced incorporating the photographs in the particular complete denture or partial denture processes. Now, generally, it is not much practice because, again, what I feel is photos are again, very misleading. The idea is what? Because one thing, this would give us a very small picture, and from a very small picture, we won't be able to find out that this is a real individual. Number two, they won't be able to again resist a very high temperature because fire related incidences, the photos and every data, would be all lost basically. So the data would be tampered, and definitely we won't be able to find out, or this won't be able to help in the identification. So we won't be very actively working as a dental detective in these particular cases. So this is how, this is as far as the picture is concerned. This was what sent. This was sent to me by one of my very good friend and a senior practicing in New York. So this can be practiced as you feel. Barcodes, now is the era of barcodes, QR codes. Very commonly, everybody knows what a QR code is. So this is again a very good system. What we can say, it's a packaged information system in just a small code. You can just incorporate it and you can just scan. Now, scanning is very easy. You can take a normal smartphone and you can just scan. So any sort of information, would give you a good idea what kind of information you desire, and would have probably help you in identification of the particular individual. Now, barcode has have to be very, fire resistant. It is very important that a particular bar code you are using has to be fire resistant, because fire-related incidences, very few of the denture identification methods, they do work, else they won't. This is how you can use probably any scanner, not a normal smartphone scanner. Everybody has a smartphone nowadays. So probably you can use a QR code app, take a normal, open a camera. There is a feature of QR code scanning. You just scan the code, and this would give you a package information. You tend to get, you will be surprisingly, you would be knowing that it has a lot of information which is there inside. So coming on to chyloscopy means that you are studying the lips. So every particular individual has a particular lip pattern, may be associated with elevations, depressions, and forming a characteristic lip pattern. Now, examination of the same is known as chyloscopy. So it helps in not only in the personal identification but also helps in criminalization. This is how, not every individual has the same pattern of the lips. So you can probably take a picture, you can take a mark, you can take a pattern on that particular lip. There is again, methodology is so much, it is so extensive that it would be again beyond the scope of the presentation. So probably you can you can identify as a detective, you can see what kind of pattern you can draw it, you can relate that particular pattern to a particular individual. So again, there are a couple of methods, as I told you, not going into detail, direct, indirect methods. Not many methods have been discussed in picture, but I would be limiting this to this only. Rugoscopy, rugo means rugae. So everybody has a very characteristic palatal rugae pattern. So they're irregular asymmetric ridges of the mucous membrane and can be seen, they are just a branched kind of processes. Ridges which project from the incisive papilla can be seen on the interior part of the palate. And what we do is very commonly we make an impression and we pour a cast, we prepare a model, and on that model we can just check how these rugae feel like. They have application not only as a forensic prosthodontics, but also in anthropology, comparative anatomy, genetics, forensics, of course, prosthodontics and orthodontics. As I told you that rugoscopy, you can pour a model, you can study that model, you would see that, this was one of our project also. I taught one of my students to work on this, and surprisingly, we came out with wonderful results. Our observations were something very different, and truly, I would say that rugoscopy is one of the most important methods of identification in forensic prosthodontics. Bite mark, very common. Bite mark, you must be seeing in movies and other way around. That bite marks, they give you very good evidence, criminal evidence or identification. So various tools, Photoshop, you can use it, you can just view it. Nowadays we have AI based tools, artificial intelligence based tools, which would help you relatively better than what we used. Particular softwares, we used to have a very limited number of softwares. But nowadays, we have a plethora of AI based tools which are available, which would help us in a better way. DNA, very common. DNA sampling. Again, in movies, we used to see DNA sampling. How does it take place? So we take a blood sample, we isolate the DNA. It helps us a lot and gives us a true picture of the human identification, including teeth, bone, tissue, hair bulb, biopsy, saliva, blood. It is far most truly and acceptable method, DNA identification in forensic odontology. Other than the prosthodontics also, we follow this particular method. Because truly it is a good method of determination. And human pulp. Pulp gives us vitality to the tooth structure, particular tooth. So what we do is, particularly when we remove the pulp, sometimes when we remove the pulp, we can move it, particularly in treatments like root canal treatment. So pulp is removed, and from that pulp, we can in fact identify the X chromosome. So sex determination can even be done. It's a very good human tissue which gives you exact data. of the genetics, that is X chromosome present or absent. Mandibular canine, again helps us to determine the morphology of teeth. I would say varies from individual, whether it's a male, whether it's female. Mandibular canine uh, index gives you good idea whether it's a male patient or a female patient. Enamel rod patterns, couple of times enamelloglyphics, we say carving on the enamel. So enamel, it is not straightly pleasant. It is in a form of a carved out carvings, or you can say it has a particular pattern. There are a couple of methods which we follow, and the age-related changes. Enamel, is it degenerative? It is in its formative stage. So many patterns you can judge it, and from that you can just identify the age of the individual. This is how you take a section of enamel. Human tissue, tooth tissue, we say, is always has enamel, dentine, and pulp and cementum on the root surface. So particularly all these tissues, they give you a very good idea, which would help not only the forensic odontologist but primarily the forensic prosthodontist. The translucency of the dentin again is very important for the age estimation of the patient. Panoramic radiography, what we say is the bigger sized OPG, orthopantomography. So it gives us a good idea, particularly by assessing the stage of eruption, because all teeth, we have two sets of teeth, deciduous and permanent. So we get a far better idea from the OPG, which tooth is coming, which tooth is going to fall. So like that. And deposition of secondary dentine. Third molar estimation, again, it's very important when we say that the wisdom tooth is going to come. That again can be assessed and identified through the panoramic radiography. This is how panoramic radiograph looks like. Dental surgeons, particularly if they are here, they must be knowing better to the other people, because routinely they are using this as a modality of radiograph in their routine clinical practices. So probably this is how a radiograph looks like OPG. So let me conclude my session. The contribution of a forensic odontologist in medical legal proceedings cannot be overstressed. In spite of having progressed by leaps and bounds through various techniques in identification and in investigative criminology, humanitarian or humans aim to pursue volunteering dental surgeons during past disasters, and they should be refrained to assure quality work and high forensic standards. Guidelines and international principles and codes are needed, especially when working in international areas. So India, probably, I think it should be, this part of the forensic or forensic dentistry should be covered. I would like to urge the higher authorities, Dental Council and Indian Dental Association, other higher authorities to take up this matter and probably incorporate the same in the upcoming curriculum of contingency or competency based curriculum system, so that it helps the torch bearers of our society, are budding dental surgeons and dental practitioners in a big way. So this is how India and foreign, abroad, this thing is already practiced in a big way. So probably I think India is also doing really well as far as the forensic odontology is concerned. The only thing is the thanks to Team Conference Mind for giving me such great podium so that I can spread such awareness to my fellow colleagues and the other sweet audience listening to me. I hope you didn't feel like this while listening to my presentation. Hopefully, you enjoyed this presentation. And I always tell my students that you learn to accept failures in life. That is very important. And if you are not seeing failures, that means you are not working enough to come up to a greater level. Okay. So we always keep saying sky is the limit. I think sky is not the limit. Our vision is the limit. So you should, broaden your vision, amplify your vision so that you work more, particularly in the field of forensic prosthodontist. And No wait for tomorrow, day after. Start right now. So if you practice today, you tend to learn more and more. Thank you so much once again to my team, my conference mind family. Thank you for giving me this great opportunity out here, so that I could spread some form of awareness, mass awareness to my fellow colleagues. And it was very nice meeting you once again. I'm so sorry I'm not live here, but I'm really enjoying this session. Personally speaking, honestly speaking, if you have any queries, any questions you have in mind, please you can take a photograph, or you don't forget to ping me up on my mail. My number is written there. These days I'm quite active on the social media handles, so you can ping me up. You have any questions, anything in your mind, please do ping me up. You have any inputs, I would like to welcome your valuable inputs, and any criticism, definitely I love to take those positive. So thank you so much. Have a wonderful day ahead, and wishing my other co-presenters all the very best for their particular presentations, keynote sessions, and once again, thundering applaud for Team Conference Mind for putting up such an excellent show. As always, they are doing, from not the first time, from past couple of years. They are putting up. They're working from pillar to post to put up such an excellent show with us, giving us such a wonderful podium to speak. And personally speaking, I'm really thankful to all of them. Thank you so much. Have a great day ahead. Namaste. Thank you.